brief introduction about Dr. S. Jayakrishnan, Product Specialist, Dermatologist Division, Lace Tech LLC.
Good morning to all of you. Myself, Dr. P. Sudha, Assistant Professor in Biomedical Engineering Department. It is my pleasure to welcome our Chief Guest of the day, Mr. S. Jayakrishnan, Product Specialist, Lace Tech LLC, Abu Dhabi. Our Principal, Dr. D. Vasudevan, our Chairperson, Trimadi Dharalakshmi Ammal, our Pro-Chairman, Rotarian RSK Raghuram, and our Head of the Department, Dr. V. Jayanti, and faculty members and my fellow students for this webinar on medical laser. The main objective of this webinar is to gain knowledge on lasers in medical field. Once again, I welcome you all for this webinar. Thank you.
Thank you so much, ma'am, for your wonderful words. And now I invite Sudha, ma'am, the Assistant Professor of Biomedical Department, to give a brief introduction about Dr. S. Jayakrishnan and also tell about his works.
Good morning to one and all present over here. I feel honored to welcome the chief guest of today's webinar, Mr. S. Jayakrishnan, Product Specialist, Dermatology Division, Lace Tech LLC, Abu Dhabi. He completed his BSc in Physics from BAM College, Kerala. He graduated from Vellalar College of Engineering and Technology, Erode, with BE in Biomedical Engineering. He has worked as a biomedical engineer in Amrita Institute of Medical Science and Research Center, Ernakulam, Kerala, and Tawan Hospital, Dubai. He has also worked as a biomedical service engineer in Nile Establishment for Medical Equipments, Dubai. We are indeed proud to have such a great personality as our chief guest today. And students, definitely this webinar is going to be a more useful and more informative session for you, and please make use of this session. Thank you for giving me this opportunity. Thank you all.
Thank you so much, ma'am. It will indeed be a really good session, I hope. And now I invite Dr. S. Jayakrishnan, sir, to start about his webinar based on laser. Thank you, sir.
Good morning, madam. Good morning, students. Hope you all can hear me, right?
Yes, sir.
Let me one second. And to share my screen, just wait for a few seconds. The sharing option is enabled, right?
Yes, sir. Yes, sir.
Yes, sir.
Thank you, ma'am. Thank you, Shubha, for this opportunity to speak with you all. It's a non-working day for me in UAE, but I'm happy to sit with you all, and I'm happy to share my minimal experience. As Shubha told, I just finished my BE Biomedical from VCET, Erode, and I'm a classmate of Shubha also. It's like almost like 12-year experience in this field, and it's not very huge, but I would like to share the minimum experience like I got from this field, especially in the laser field that I'm working for the last couple of years. We all are studying, like I think in first and second semester, we are studying some fundamentals of the of lasers. But we are not going very deep into this subject because we are diverting the whole biomedical, we are more going into diagnostic equipment, therapeutic equipments, a lot of things we are studying till our final year. But laser is a very big field, and it's most widely used technology nowadays in medical field. Not only in medical, we can see laser everywhere. Not only in medical, you can see it in industry, you can see it in military applications, we can see it for the entertainment. Many things are there. Now, many technologies has been replaced by laser because of the precision. Means you are using when you use the terminology laser itself, like how it is a precise technology, right? And I'll just go through some basics. So we'll just to you remember, like all these things we studied in the physics. I think physics 1 or physics 2, I forget. I think it was in physics 2, I remember. Like laser, very simple basic theory, light amplification by stimulated emission of radiation. As you know, like we are studying some basic physics, like the excitation of the electrons from ground state to excited states. When it goes to excited state, it will collide with the photons, and it's like a stimulation is happening. A single electron photon collision will like multiple number of photons are generated in this stage. So we call it as a stimulated emission of radiation. It's not a radiation actually; it's purely light. But we are using the terminology radiation. And the laser have many properties: monochromaticity, coherence, collimation, high intensity. All the conventional light, like what you're seeing, have a wide range of like we can tell that from different colors are there, and it have like a different wavelength also, right? But laser will be coming with a single wave, and the directionality, once it is shooted to one place, it will hit the target. And it's coherent also because all the beams are in a single phase, not like normal light. These are the commonly used lasers in the market nowadays. It starts from visible spectrum to infrared. Like some of the laser you can see with your normal eyes, but some of the laser you cannot see. Start 100 to 3 micrometer, you have like a wide range of lasers in the field right now. And when you're using laser in the medical field, we have to make sure that the right laser is used for the right application. So if you want to use a particular laser for a particular application, you should know the properties of that laser. So we should know how the laser is going to affect that particular, if you are using it for a tissue or any other things, for industry or any other thing, we should know like how the laser is going to interact with that particular material. So if you understand the basic physics, like how the physics of the laser, you can avoid a lot of complications also. And this is a common laser, this structure we are studying in the physics class, and it have a lasing medium, it have a pumping source, and it's almost like I will share you some video like later on, and then you can understand, you'll get more idea about how a real laser will work. Okay, it have like a reflective, partially reflective, and highly reflective mirror on both sides. So the entire laser is generated in this laser medium. What laser we are seeing outside, the entire laser will be generated in this the lasing medium. According to this particular lasing medium, the type of laser will be different. So this lasing medium will be solid, liquid, or gas. and the pumping source will be also different. Pumping maybe we are normally using some type of flash lamps or some other. Sometimes we are using some other diode or some other materials we are using for the as a pumping source, and this lasing medium will define the wavelength also. For example, if you are telling like this is the wavelength of a particular laser, this property will change according to the laser, this lasing medium. So normally for the pumping source, we are using some electric current also we are using nowadays with the new generation lasers. Once the laser is produced in a medium, we have to deliver it to it outside. Like when we are using the machine, the laser for any application, we have to deliver it outside, right? We have different type of delivery systems we are using. Normally, we are using articulated arm, hollow waveguide, optical fiber. Optical fiber is very common nowadays. You know, like for any applications, we are using optical fibers nowadays, and handheld unit. And this articulated arm and optical fiber are the most commonly used laser delivery systems nowadays in the market. And for the handheld unit, some of the dental applications like low power lasers, we are using the handheld units also. Lasers are classified into different, as I told you, like the lasing medium. According to the lasing medium, we are classifying the lasers. Sometimes the lasing medium will be, lasing medium means it's very simple. Like it's a medium where the laser is generated, laser is produced. If the laser is produced with the help of any liquid, something we call it as a dye laser. Sometimes we are using some gases like CO2, argon, excimer. Sometimes the lasing medium will be solid state. Solid state means normally you are using flash lamps nowadays. This is the most commonly used technology in the field, like ruby, alexandrite, erbium YAG, ND-YAG, thulium diode. And nowadays, some of the lasers, some previous generation lasers like erbium glass, CO2, all these lasers has been replaced by semiconductor technology. You know, we are improving a lot in this field. So we are replacing some of the old technology with the semiconductor technology. And as I told you before, it have a wide range of wavelength. It have visible spectrum, near infrared, mid infrared, far infrared, and UV region. And there are two operating modes for the lasers. One is continuous mode and pulse mode. It's something it's very simple. Something is like continuously coming, and one's something like pulsed also. And pulsed also we have two options. Long pulse and short pulse. You know, if you select any laser, the laser we have like an option to select either it's a short pulse as a long pulse. And these are the common laser applications in the medical field: dermatology, gynecology, urology, dentistry, ophthalmology, otolaryngology, cardiovascular, and orthopedics. So we have a wide range of applications. And we have a wide range of lasers for our medical field also. To understand, as I told you, like to use a particular laser for a particular procedure, we have to understand how the laser is going to interact with that. You know, if you are using it for a tissue, or if you are using it to remove something, if you are using it for a surgery, for any procedures, we should know how this particular laser is going to interact with that target. We call it as the target. We will just use the terminology known as chromophore. Hereafter, we'll in many of the slides you can see this terminology chromophore. The chromophore, it's very simple. Like a particular target, like a specific target, will absorb a specific wavelength. So we call this as a chromophore. It may be like the chromophore is, many type of chromophore are available in our body. You know, we have melanin, in our skin have melanin, we have a hemoglobin, and we have water, right? So these are the common chromophore. These are the common target for the laser. And some external chromophores are also available in our field. Like, you know, it's very common nowadays, people are using tattoos. And it's a question like, if you do the tattoo, is there any possibility to remove this one? Laser is the only option for you to remove. Either you have to do the surgery, or you have to use the laser to remove the tattoo. A tattoo, you know, like many type of inks are used, you know, colorings, like different colors. Nowadays, it's very common. The youngsters are using tattoo in your body. and tattoo can be easily removed with the help of lasers. And laser have these 4 properties like absorption, reflection, scattering, and transmission. Once you use a laser on a target, the particular wavelength will be absorbed by the medium, and the target we call it as a chromophore. And certain like a few percent of the laser will be reflected actually. Like our skin have like a different structure. We have like we called as one of the structure with stratum corneum. Some like a 4 to 6% of the light will reflected at this layer of the skin, and again once it go into deep, it will be there will be a scattering also. Either the laser energy, like a laser, it's like a huge quantity of energy will be there, and this energy will be scattered inside our structure like any target. And the scattering have like, if the wavelength is less, if for example the shorter wavelength lasers will scatter more and the longer wavelength will penetrate more, that means the scattering will be very minimal for the longer wavelength lasers. Next thing is transmission. Okay, we already it's already absorption is finished, reflection, scattering finished. Next we have to transmit to the target, the particular target. For example, if you are targeting, like for example, if you are targeting laser to the skin, certain like a huge amount of energy will be absorbed in the superficial layer, like like water is the common content in our body. So some wavelength will be absorbed by the water, some wavelength will be absorbed by the blood, and some wavelength will be absorbed by the melanin. Melanin, it's the color of our skin. The melanin is the one which is giving color for our skin. So these are the common terminology we are using for the laser interaction with the tissues. And laser have many reactions. As I said, like once the laser reach the target, it have many reactions. Either it will be like a photothermal or a photomechanical or a photochemical or a selective thermolysis. These are the 4 reaction of the laser with the target. Sometimes the laser the laser it's like it's a very, as I told you, it's a very huge energy we are delivering to the target. So this energy can be converted to thermal energy. Sometimes it will convert to a mechanical energy. That means some of the, which is like especially for the tattoo removal, we are using this particular, we are scattering, like we are actually the tattoo ink actually, to nanoparticles. This is commonly used for this photomechanical. It's commonly used for the removal of tattoo, and it's even used for some of the lasers like dye lasers for the removal of vascular abnormalities. And photochemical is the one we are using for certain surgical procedures. We are inducing some photosensitizers. So we are using, and this particular sensitizers will absorb the particular wavelength and it will induce the tissue damage. And the selective thermolysis is also the same, like a specific chromophore. Like a particular chromophore will be, chromophore will absorb the particular wavelength and it will damage only that chromophore. It is not going to damage any surrounding tissue. So like different parameters are there. Once you get a machine, like a laser machine, we can select the wavelength, you can select the pulse duration, we can select the energy. We normally call the energy as fluence. It's how many joules of energy. It's like any other devices, we are measuring the energy in joules or in watts. Okay, and we can control the speed, you can control the spot size. Many parameters are there in a single machine. These are the few major parameters in a normal laser machine. And these are the range of lasers. As you know, like it started from excimer and it is ending with the gas. So you can imagine the range of laser, like 193 nanometer to 10600 nanometer lasers we are using for the dermatology field. Let us go to some of the major lasers used in the field. The first one actually, like as I told you, like for around like 10 to 15 different type of lasers are used in medical field. One of the commonly used laser is argon laser. Argon means it's very simple. It's a gas laser because the active medium is a gas. And the major target for the argon laser is melanin, hemoglobin, and water. So these argon lasers, like before, it was used widely for dermatology field, and later on nowadays it is widely used for the ophthalmology field for some surgical procedures, something like treating of glaucoma and diabetic eye disease. All these things can be done with the help of argon laser. Actually, argon laser, a wide range of laser. Once the laser started working, like around 6 different wavelengths are generated in a single laser, and out of the 6 wavelength, almost like 80% is like 488 and 550 nanometer. These are the commonly used argon wavelength from the argon laser. Next one is copper vapor laser. Copper vapor laser is same like gas lasers. It is producing wavelength, it's producing green light. That means you can see the laser, it's visible, and yellow also. So both lasers are visible, and it's mostly used for some vascular treatments. Vascular, when I'm telling you vascular treatments, means something related to the blood vessels. Either it will be treating some superficial, you can see the blood vessels on the surface of your skin, right? We call it as a vascular disorders. Some of the vascular disorders we call it as, for example, it's very common, like nowadays, a lot of lasers are used for, treating blood vessels, especially for some blood cell abnormalities, blood vessel abnormalities. And krypton laser is also same, is more or less same like argon laser. And it's used for some of the ophthalmic procedures, especially for the coagulation of the retina. Next one is ruby laser. Ruby laser, it's a commonly used laser for dermatology application, mainly for dermatology application. It is very commonly used, and this is the first laser used for the medical application. Like when laser initially, it was lasers were used for some other for example, it was used for industrial and other technologies. But when we started using the laser in the medical field, ruby laser was the first laser used for the medical application. And it's a solid state laser, and the active medium is like a ruby. It's a ruby crystal, and we have a pumping source like either a xenon flash lamp. And it's used in dermatology field for hair removal and pigmental lesions. Actually, nowadays we are not using ruby laser for this dermatology application, but it is widely used for the pigmental lesion treatment. And ruby laser is, later on I will explain you, ruby laser is used as a Q-switch laser also. In ophthalmology laser, it is used to photocoagulate vascular and pigmented retinal lesions. And in dentistry also, we are using ruby laser. For example, like some hard tissue removal, we are using the ruby laser for making some cutting, like instead of mechanical cutting and drilling. When you are going to dental hospitals, and if you go to a dentist, instead of using mechanical cutting and drilling, some lasers are used nowadays. Ruby laser is one of the one. Next one is Nd:YAG. Nd:YAG have a wide range of wavelength, 1064, 1320, and 532. And if you ask me, Nd:YAG is the most commonly used laser in the medical field, because Nd:YAG is we are adding this. And I think it is the Nd:YAG is the one we are studying. Helium neon and Nd:YAG is the one we are studying in the engineering physics also. So as I think you all people remember the terminology, neodymium aluminum garnet crystal. It's a crystal. It's a natural. I will show you some images of the crystal, the material we are using in the Nd:YAG. Nd:YAG is widely used for dermatology, hair removal, pigmental lesions, vascular, like some nail removal, and it's even used for the skin resurfacing also. It is widely used to certain wavelength like 1320. In ophthalmology, let me explain you some one terminology in the laser. We have different type of lasers according to we have normally we are using nanosecond lasers. Again, it's going to picoseconds. Picosecond means again it is going less than, you can imagine like in 10 to power minus. and it's again going to the femtosecond. And these femtoseconds lasers are most commonly used for the ophthalmology application. And for most of the surgical, like minute corrections and everything, we are using femtosecond Nd:YAG lasers, commonly for the ophthalmology department. And in urology, initially these lasers were used, still some of the procedures we are using Nd:YAG lasers for some prostate surgery applications. Some hysteroscopy procedure also we are using the Nd:YAG laser. And in cardiology, we are commonly using the 1320 nanometer. In Nd:YAG also we have different wavelength. This particular 1320 wavelength we are using for some of the cardiology applications, some of the pulmonology, for some of the procedures, small surgical procedure, we are using the Nd:YAG laser. And it's also used for the oncology. Oncology is something related to cancer, as you know, for treating some benign thyroid nodules, primary and secondary malign liver lesions. We are using the Nd:YAG laser. Q-switch laser. It's a Q-switch laser. We commonly use three type of Q-switch lasers. One is Nd:YAG, one is alexandrite, and next one is ruby. And this is a very big subject, and I have to. It will take like a full day to explain about the switching technology also. Actually, it's very simple. I will explain to you something which is normal Nd:YAG will be generated, and we are using some frequency doubling, like we can call it as an attenuator or some other terminology we can use. And different switching technology is also available, like active switching, passive switching. We are actually placing something in the beam. Once the beam is generated like 1064 Nd:YAG, we are keeping some frequency doubling crystal on the direction of the beam, and we are converting this beam to like another wavelength. For example, we are switching at the laser. Actually, is widely used for dermatology. It's mainly used for dermatology. As I told you before, it's widely used for the tattoo removal. If you go to any clinic for doing the tattoo removal, Q-switch laser is the one which will be used. Even in Q-switch laser also, like different wavelengths are there: 1064, 532, ruby, and alex. And according to the target, for example, some of the colors of tattoo, like black and blue, it can be easily removed with 1064 nanometer. Some of the red colors can be easily removed with the 532, and some colors like black, blue, green. If you see the tattooing nowadays, you can see many colors, and we cannot use a single laser to remove all the colors. We have to use multiple lasers for to remove the body, and this is commonly used treatment also. And some of the pigmental lesions. In our skin, you can see some lesions, like some abnormalities, and it's used for the hair removal also. Like we can remove the like very super fine hair. We call it as hair bleaching. And nowadays we are using picosecond lasers widely in the market for the tattoo removal and for skin resurfacing also. If you have some skin abnormalities, we can treat it with the help of picosecond lasers. Normally nanosecond lasers were used, and nowadays picosecond lasers are used, because these lasers can be used to remove the colors very quickly. Next is alexandrite laser. Alexandrite laser is a visible laser. Once you shoot the laser, you can see it. It's commonly used for dermatology applications. It's a solid state laser, and the medium, the medium where laser is generated is an alexandrite crystal. It's a naturally occurring crystal. I will show you the image of the crystal later on. It's commonly used for hair removal, pigmental lesions, vascular treatment, and tattoo removal. This is erbium glass laser. Erbium glass laser, it's before erbium, as I told you, like many generations are there for the laser. Initially, xenon flash lamp was used as an active medium. Later on, nowadays we are replacing the xenon flash lamp with the diode pumped solid state technology. So we are doping. Doping is it's a physics terminology. We are doping one material with other material to produce a new material, right? So we are doping the yttrium, and we are doping some other material with the erbium, and we are using it for the laser generation. It's commonly used for non-ablative resurfacing, skin tightening, scar treatment, wrinkle removal, pigmented treatment. We are using the erbium glass lasers. Next is erbium yak. Before I told you about erbium glass, and next one is erbium yak. Erbium yak is purely a ablative laser. Ablative laser means if you shoot the laser on your skin, you can see it may damage your skin actually. Wherever you are shooting, like for example, where you are targeting, that area will be damaged. So we call it as tissue ablation. We are commonly using this laser for the ablative procedures. This erbium is also a naturally occurring material, and erbium doped with yttrium, aluminium, garnet, which will emit the infrared range. That means you cannot really, it's in infrared range. So it is the target. The main target is water. So it is water will selectively absorb this particular wavelength from the device, and is widely used for a lot of applications, especially with dermatology, dental, and gynecology, mostly for the ablative procedures. For example, if you want to remove something from your skin, or if you want to do some ablative procedure, we are commonly using erbium yak lasers. It's for ablative treatment. Pigmentation treatment also we are using. And erbium yak is the most commonly used laser for dental procedures, for hard and soft tissue applications. In our dental, our mouth, we have like a soft tissue and hard tissue. Some of the tissues in our mouth are hard tissue and some are soft tissue. It can be widely used for both applications. And erbium yak laser is widely used for gynecology application, for the vaginal laxity, stress urinary incontinence, pelvic organ prolapse, and vaginal atrophy. That means nowadays, a lot of conventional treatments has been replaced with the help of lasers. Before, we are doing some surgical procedure, and this surgical procedure has been replaced with the laser. And this is one of the field in gynecology. We are widely using the erbium yak lasers. Next one is dye laser. Dye laser, it have different wavelength. It have two wavelength also, 577 and 585 nanometer. And we normally use the rhodamine dye. Rhodamine dye is something like dye, as you know, since you are we are from Tamil Nadu. We know, like we are using dye for coloring as a coloring agent, right? And we are exactly using a similar dye. We call it as a rhodamine dye to produce the laser. It is a most commonly used laser for some of the dermatology application, especially for the vascular treatment. Means superficial vessel removal of superficial layer, superficial vascular. We are using a dye laser, and it was used for psoriasis treatment. Psoriasis is one of the skin abnormality. We were using this laser for psoriasis before, and it's used to treat scar. Scar, once you have if you undergo some surgery, or if you had some accident or anything, scar may come. We may having some scar in your face or in your body, and these type of lasers were used to remove the scar. And it have a different generation also. Nowadays, this has been replaced with solid state lasers, because even our company have a laser. As this rhodamine is a consumable, actually, if you are using or not using, there is a life for this dye. And at certain stage, the life of the dye will be finished, and we have to replace the whole rhodamine. So it's very expensive. So this rhodamine has been replaced with solid state laser. We have some laser available with our manufacturer also. We are replacing this dye technology, and it is widely used for. It is in different applications. We are using different wavelength and different pulse duration. Pulse duration means the duration of the laser. We normally use most of the applications. We are using it in nanoseconds. Next is excimer laser. Excimer laser have different wavelength. This different, as initially I told you about some of the gas laser. Excimer laser is also a gas laser. We are using normal noble gas, argon, krypton, and xenon. These are the active medium, and we are adding some reactive gas. Something, we need some reaction, right? Then only the laser can be generated. So we are adding some reactive gas known as fluorine and chlorine also. And according to the reactive gas and the noble gas, there are different wavelengths also. For example, argon fluoride 193, krypton fluoride 248, xenon fluoride 308, and xenon fluoride 351 nanometer. Different wavelengths are also available. And this is very commonly used in dermatology for the psoriasis treatment. You can see, I think you all people know about this particular skin disorder, like psoriasis, vitiligo are the as one of the most complicated skin disorder with us, and XML lasers are widely used for the psoriasis treatment. And in ophthalmology department also, we are using it for some refractive errors also. For example, we are using for myopia, means nearsightedness, and some hyperopia, we are using this type of laser. And it's also used for removing the tissue from the anterior cornea. We call it as photoablative decomposition. And in cardiology, XML laser 308 nanometer is used to treat coronary arterial disease. It's very common. We are all studying about some heart-lung machines. We are always studying about some of the cardiac procedure, means most angioplasty, angiogram, all these things, right? Cardiology is one of the biggest department in a hospital, and we are using a lot of procedures. And most of the time, if you have any cardiac disorder, either you are going for angioplasty, where we are putting a stent, or we are going for an open heart surgery. And nowadays, lasers has been used to treat this type of coronary arterial diseases. And if you ask me, this is the most expensive laser available in the market, which is used in the cardiology department. It's very rarely used because it's very complicated, and it's we need a very high precision, because we are going to treat the the arteries in your heart. So we are using a high precision laser. XML laser is the one we are using in the cardiology department, and this is the most expensive. Even in dermatology also, the XML laser is very expensive because it's very difficult to maintain, and it's very complicated also. IPL is not Indian Premier League. IPL is intense pulse light. This is not a laser actually, but it is commonly used in the dermatology field because it's like a non-laser lamps produce a non-coherent broadband light with a different wavelength actually. Same like laser, it have a different wavelength also, from 515 to 1200 nanometer. And we are using a lot of filters. As the image, I think you people can see the image, like different filters has been used. According to the filter, it is something like we are using in the physics lab, we are using some grating or something, I forget the term, something we are using to measure certain wavelength, right? Exactly same, we are using different type of filters. According to this filter, also will change. And it's widely used for the vascular treatment, hair removal, and pigmented lesions. Now, very rarely we are using this device in dermatology because it's a very complicated one also. If you make any small mistake, if you put a wrong filter, it will definitely make burns. So it is very complicated. Nowadays, it is very rarely used in dermatology field. And this is one of the property of laser, photodynamic therapy. Photodynamic therapy, as I told you, like we are inducing some photosensitizing agent, like something I think you are studying about fluoroscopy or some other procedures in radiology field. We are inducing something into our body, and we are doing some diagnosis. Exactly same we are doing, but we are using it for in a therapeutic procedure. We are inducing some photosensitizing agent, and this particular photosensitizing agent will absorb certain wavelength. So if you are mainly it is used for the cancer treatment. Cancer cell will absorb the particular photosensitizing agent, and once you shoot the laser, this sensitizing agent will absorb the laser, and it will destroy the cancer cell. It's not very common, but it's still used in the oncology field also. CO2 laser and Erbium laser are the most commonly used. Ablative laser means we are just doing the tissue vaporization. Once you use a laser on your skin, it will just vaporize the skin, and it is mainly used in dermatology, gynecology, and some surgical procedure also. In dermatology, we are using it for the ablative resurfacing. Resurfacing means, if you use the laser, you can remove the superficial layer of the skin. But it is not going to deep. It is in micrometrally. We can remove the superficial layer of the skin, and it's used for some of the vascular treatment, but it's not commonly used. And in gynecology, as I told you, it will just vaporize the skin. So it's widely used for the excision, ablation, vaporization of soft tissues in pelvic and vaginal anomalies. Normally we are using some electrosurgical units. I think third year and fourth year students knows about electrosurgical unit we are using in the hospital. But nowadays, this electrosurgical, some of the procedures done with the electrosurgical units has been replaced with laser. And it is same like Erbium YAG laser. We are using it for the treatment of vaginal laxities, stress urinary incontinence, pelvic organ prolapse, and vaginal atrophy. And nowadays, before the CO2 laser, as you remember, these lasers were before were directed. The output was coming out through some it was used. We are using some other technology. Nowadays, we are replacing those technology with the laser fibers. So fiber means you can insert it to any either you can insert to your mouth or any other part of your body. If you're making a small cut in your body, you can insert the fiber through that small cut. So this we are using CO2 laser fibers. We are for some of the endoscopy and robotic surgery procedure. We are using the CO2 lasers. And in laparoscopy, colposcopy is the one. It's one of the major department in gynecology. We are doing some cancer diagnosis and with the help of some scope, and we are doing some procedure also, some surgical procedure also, and we are using CO2 laser in the gynecology. And respiratory also, for some transoral laser microsurgery, like we are using it for some microsurgery, we are using CO2 laser because it's not going to damage the, it is particularly damage the target, the specific target. It is not going to damage the outer structure of any tissues. So we can avoid the suturing. Once you have some surgery, we have to make some sutures, right? We have to avoid the suturing also. In otology, means like in middle ear, treatment of like your ear, to do some surgery, we are using the CO2 lasers. And in neurosurgery also, as I told you, nowadays flexible CO2 laser technology means we can deliver the laser with the help of flexible fiber. So we are using it for some neurosurgical procedure also. Diode lasers, it have a different wavelength, something like Nd:YAG, starting from 800 to 930 nanometer. We have a wide range of applications for diode lasers. And nowadays, it is widely used and surgical applications, and we are using it for the physiotherapy and some vascular treatment also. We are using the dye lasers. In dermatology, we are using for the hair removal, vascular treatment, and pigmented lesions. We are using diode lasers. In surgical application, we are using it for the ENT, for the upper part of the body. If you want to do some surgery or some small cutting or coagulation, we are using the diode lasers. And it have the advantage of the diode laser is the target. We have two target actually. Either it will be absorbed by the hemoglobin, means hemoglobin in our blood, or it will be absorbed by water. Water is very common, in our body. So it can absorb by it. So these diode lasers are used for most of the applications. It is used for the thoracic surgery also. Some of the lung surgery we are using. In phlebotomy, this is one of the most commonly used laser for the varicose vein treatment. I think most of our the elders, especially even nowadays, it's very common with the youngsters also. You can see the varicose veins in your legs, and diode laser is the one which is used to treat the varicose veins, and it's very effective also. It's proven and very effective also. And in orthopedics, means mainly in the physiotherapy department, we are using diode lasers for the pain management. If you go to a physiotherapy department with some back pain or joint pain or something, even nowadays they are using the lasers to treat the physiotherapy condition also. Holmium YAG, as you know, this is yttrium aluminum garnet, and we are doping it with the holmium. So these are solid state laser, and holmium YAG is the most commonly used laser for the urology purpose. And it is used for many applications like urology, laparoscopy, neurosurgery, lithotripsy, angioplasty, orthopedic, and many things. And this is the most commonly used for the urology procedure, especially for the kidney stone management. We are using kidney stone management and the prostate surgery. We are using holmium laser. If you go to a hospital to treat the kidney stone, either they will be using some shockwave technology, or they will use the laser. And holmium YAG laser is the one we are using commonly in the for the kidney stone management. And it's small. It is to use for removing the prostate also. Prostate cancer is common with males, and we are using, normally we are removing the prostate, and we are using a holmium YAG laser for this procedure also, because it's very accurate. When we are doing a surgery in a sensitive area, we are not going to damage the other, the neighboring tissues also. We are just going to remove the particular tissue we require. So the minimal post-operative complications and eye efficacy is the major reason why holmium YAG laser is used in urology field. Holmium, thulium, and green light. These are the three major lasers used in urology field, especially. Urology, as you know, like it is something related to our lower part of the body. And thulium YAG is one of the laser which use same like holmium. We are using it for many applications, especially for prostate surgery. We are using the thulium lasers, and in thoracic surgery, nephrectomy, gastroenterology, ENT, and general surgery also we are using thulium lasers, because these are like these are very, it's like something like a very sharp knife. It is something like a sharp knife. We are making the cut, high precise cut. We are making with the help of the lasers. Green light is one of the laser which is also used in the urology field. We call it as a KTP, potassium titanyl phosphate, and because green light will be very quickly absorbed by any red substance, like especially our hemoglobin will absorb the green light very quickly. Before it was used for facial, like facial telangiectasia, pigmented lesions, all these things we are using. But it's used in prostate surgery also, especially for the removal of prostate. It's very complicated. If you see the green light application in the urology, you can see the whole operation theater will be like with green light, because it's a visible laser, and it's also used for the ophthalmology also. Some of the photocoagulation procedure we are using the green light, and these are the most commonly used laser application. Laser have many classification also. If you ask any technical people what type of laser you are using, we will tell you like class 2, class 3, class 4B, and these are the major classification of laser according to the safety point of view. It's like class 1, class 1M, 2, class 2, class 2M, class 3R, class 3B, class 4. These lasers are safe for your eyes. That means most of the lasers you are seeing for the entertainment, some lasers we are, some laser shows are there. Some of the laser we are using at the in your pen. Some of the laser pointers. All these are safe for your eyes. These are the lasers used in those things. But class 3B and class 4 lasers are not safe for your eyes and not safe for your skin, because your eye is the one which will absorb the laser very quickly. We have some the structure of the eye. We are studying the anatomy, like we have something black inside, so this black part will absorb the laser very quickly, and it's very unsafe to use class 3B and class 4 laser without using any safety precautions. Either you have to wear some safety goggles, or we have to use some eye shield or something when you are using these type of lasers. And according to the wattage also, we have like different type of wattage also. And once you ask some engineers like what type of laser this one is, we will tell this is a class 4 laser or a class 3 laser or any type of laser. Normally we will tell like that only. And these are the safety procedures. As I told you, we have different safety procedures when you're using the laser. One is training for the inducer. We have to make sure that that the end user know what type of laser you are using, going to use, and what are the properties of this laser. If you are using the right laser for a wrong application, it will be like it will be a disaster, And we are using protective goggles, as I told you, protective goggles and eye shields we are using, and we are also using signage. If you enter a laser room in a medical facility, we can you can see like some signages like class 3 lasers, class 4 lasers. Like we are controlling the access also. Sometimes some locking mechanism will be there, because some of the rooms will be accessed by only by the doctors or the trained staff to avoid unauthorized access. And in engineering, we engineers, we will do some of the safety precautions also. Normally we'll be using interlocks. Interlocks are very simple, like it will be connected to the machine, and once the machine is on, the door, no one can operate, no one can open the room. Or if someone accidentally open the room, the laser will stop automatically. Especially for the lasers like green light, the whole surgical room will be in a greenish color. And if any unauthorized person enter into that surgical room, it can may face some severe, either it will be eye or any other any issues they may face. And we have a guarded foot switch also, because laser emission will be controlled with the help of foot switch or a hand control. And laser will be having emergency switches. In case of any emergency, if you feel like anything goes wrong, just press the emergency switch. Like we are using the treadmills. We use a treadmill, and if anything goes wrong, we are just pressing the emergency switch. Same like emergency switch, we have the same mechanism in the laser also. We have some audible and visible emission indicators. That means when the laser is shooting, you can hear the sound, like tuck tuck, like sound will be there. At the same time, we are using some aiming beam also, some aiming beam to see like where the laser is targeted. And we always avoid some reflective surface inside the operating area. That means, like, if you are using the laser in a room, we will not keep any mirrors, because if you shoot the laser to the mirror, laser have a property like it will reflect, right? And it will reflect and it will affect the whole people inside the room. And we have a lot of administrative control also. Like we are doing some laser safety programs, and we are training the staffs. When we people are installing a machine, and when we are giving a demonstration, we'll always make sure that the technician or the doctor is using the laser properly. These are the, and one thing I would like to tell you, like recently, why I am telling about the laser safety. One of my junior who did the studies in Velar Engineering College, actually he is working in the same field, and he's actually a service engineer, and when he was doing the service, he accidentally used the foot switch and the laser hit his, and he did like a surgery to the damage happened to his eyes. So we should be very careful. And we don't know, like once the laser shoot to some target, like we don't know what's going to happen. And if it is reflected, we don't know what is going to happen. Many of the lasers are very dangerous. And this is just like a very brief explanation, like a very brief presentation. Each topic is, for example, I think you people can think about doing multiple paper presentations on each type of lasers, because I just gave like a very brief idea about lasers, and you people can think about like a 1 week full presentation only about lasers. Like each student can take presentation on individual lasers, and you will get more idea about the lasers, especially with Q switch and all these things. It's a very big subject, and some topics I left because if you go deep into this one, this 1.5 hours is not enough for me. And for me also, I have some limitation, because I'm not a super expert. Like I'm working this field for like 2 years only, and I can share. If you have any queries, you can ask me. I'm happy to share my experience. I will show you something. I will show you one. 1 second. I'll show you like how a laser really works, right? You can see the my desktop, right? This is a normal laser cavity. This is I will just play the video. You can. Oh, Shubha, can you hear can you hear me? Can you see the video?
Yes, sir. Yes, sir.
Yes, sir.
Okay, this is a normal laser cavity. We are normally using it for some of the dermatology applications. I will just show you how the laser works.
The laser cavity. As I explained you, the laser cavity.
We can see this is a cavity where the laser is generated, and this is a medium. Like these are the like for example, we are using a lamp, like a xenon flash lamp. We are using. This is the one which is generating the photons. And we call this is the active medium. This is inserted actually. It is like we call it as a rod, and it is inserted in the cavity. This is naturally available material, and once the laser photons generated by the xenon flash lamp, it will reach the active medium, and in the active medium, the entire laser production will happen. Just have a look on the video.
An active medium and a pumping source. You can see there is a flash lamp inserted, and you can see a crystal rod inside. This crystal rod is the active medium. In this cavity, I'm showing you the alexandrite crystal. There are like many crystals are available in the market for ruby, Nd:YAG, alexandrite, erbium. Many type of crystals are available, and according to the crystal property, the laser wavelength will vary. And the cavity, inside the cavity, it is fully reflecting, and you can see like 2 holes on both sides. This is for the cooling. We are normally using water cooling for the cavity because very high energy is generated inside, so this rod need to be cooled. And the lamp is also inserted in the water cavity. Both rod and lamps are cooled with the help of water.
This is how a laser, this is we call it as the pumping chamber, or we are called it as a laser bench. How you can see a lot of optics are there, and I will just play the video. Just have a look.
How the optical bench of a laser machine normally look like. We have like 2 cavity. This is alexandrite and Nd:YAG laser machine. We have 2 sources. One is Nd:YAG and one is alexandrite. So it have like 2 cavities also. The Nd:YAG laser generation. This is for the alexandrite laser generation. As we expect, a laser cavity have one fully reflecting mirror. This optics is fully reflecting, and this one will be partially transmitting. Once we get enough energy inside the laser cavity, it will pass through this optics, and you can see like a few numbers of bending optics. These are bending optics, which will allow the laser to direct towards the output. This is the output. Here also we have like a few optics we can see. And in between, we have some electronic components also. This is a photodiode, which will measure the laser output. Actually, it will be measured in joules. And some machines, it will be measured in watts also. So, as I explained, this you can see the rod inside, and this is the lamp, and the machine which have like 3 divisions are there. This is the main part. This is like you can call it as the heart of the machine. And even the Nd:YAG and alexandrite also have separate optics from the beginning. Actually, laser is generated here, and it will pass through different optics, and it will go to the output. We have a focusing mirror which will focus the laser to the optical fiber, and I will show the optical fiber session later. And this is the electronic side of the machine. Electronics means the capacitor bench. You can see like big capacitor benches, power supply, and we have many laser machines have different charger and discharger for the high voltage power supply of the machine. And the machine also have a hydraulic section for the complete cooling. We have like many pumps. You can see some pumps for high pressure water supply for the cavity, and for air cooling also. Different type of coolings are there. For the machine we have separate air cooling, and for the cavity and everything we have the water cooling. You can see the cooling side. Now I just turn on the machine, and I just turn on both lamp sources. You can see the lamp is on, and you can see the light coming out from the road also. And now there is no laser generated right now. Once the lamp started getting high energy, you can see arcing will be there. Then the laser will be generated.
You can see in this video, you can see the laser is actually on and the laser output is also there. I just took the video for you students, like just to see how the laser is produced inside the machine. I think you all get like some idea about how the laser is working. You can see this is the laser actually. There is an output right now. Actually, here we are measuring, we have like different devices to measure the output of the machine. In this machine, we are doing a service and we are just measuring with the help of like a detector. We are measuring how many, like how much energy is delivered from the device. We are doing the service and calibration also. This is how a laser is generated. And in this video, I forgot to show you something else. In the cavity, we have like a different mechanism. We have some shutter technology in this video. You can, this area, there is a shutter. You know, it's like, it is just to stop the laser. Once, if you want to stop the laser, when you're doing a procedure, if in between you want to put the machine on standby, or if you want to stop, if you don't want to shoot the laser, automatically the shutter will get on, and it have a reflecting surface, and this laser will be absorbed by it will be reflected on the shutter, and it will be absorbed by an absorbing medium. Because this is one mechanism inside the laser machine. And these photodiodes, we have like different type of detection technologies are also available. This photodiodes is the one which will measure the output from the machine. You know, different output we will measure, one inside the machine and one from the outside also. So different places we will measure the output from the laser machine. And this is one of the commonly used how the laser shooting. We are usually for hair removal. This is how the laser will be shooted. As I told you, like some aiming beam will be there. Once you shoot the laser, you can see this red one is actually Alexandrite laser. This is how we are using for the hair removal. We are using the laser. And in dental also, we are using the dental lasers. See how this is how we are measuring the laser output. We call it as, in this case, we are measuring the Alexandrite laser, and we have some measuring tools to measure the output also, and we will make sure that the right energy is delivered to the patient. We will make sure that from the machine, if, for example, if you are asking the machine to produce 10 joules, the machine is delivering the 10 joules. See, this is as I told you, like how lasers are used for the vascular treatment. If you want to remove the superficial vascular, like a blood vessels or a capillaries on your face or a body, you can use it for. You can use the laser. You can see immediately because the hemoglobin will be quickly absorbed. Immediately the vessels will be disappeared when you are using lasers. So these are the few videos, you know, I would like to share with you, like some images also I will share you, like this is how the cavity look like. It have like a different, you know, two type of, if you open the cavity, you can see like this, we have two options to put the lamp as well as the rod. And I'm keep on telling the terminology rod. This is the rod look like. This is a naturally occurring material. Like we can see, like it have a different type of lasers have different type of rods also. This is the active medium. This is a place where the whole laser is produced. And this is how the lamp look like. Actually, we just put the connectors for the lamp. This is a normal arc lamp. It have like anode and cathode, and gas will be filled inside. And this is the medium where this is the one which is producing the the photons for the laser generation. We call it as a and this is the cavity look like. The lamp, the rod, and the whole the electrical connections. And we have to connect the lamp to the electrical connection. So we will make sure for the for the pumping of the lamp we need it. I will show you few images, like how the laser before and after, how the procedure look like. For example, this treatment has been done with the help of laser. 1 second, I will just select the whole. You can see some of the procedures done with the help of the laser. It's very common with most of the youngsters. Like we have a lot of pimples and everything. It can be easily treated with the help of laser, something like this. Even for dental also, nowadays lasers are widely used for the whitening. We are using dental lasers, and this is a hair removal procedure. We can easily remove the hair, and it's a long standing result also. For some pigmented melasma, like these are like a pigmented lesions, some like a skin abnormality, we are treating with the help of Q-switch lasers. And this is the nail fungus. It's common with those are working in the. It's very common with we people nowadays, and it can be easily treated with the help of lasers. And this is a good example for how the laser can be used to remove the superficial pigmentation, like sunburns or any other pigmentation. We can easily treat with the help of laser. And this is one of the example for the scar treatment. For example, if you have any surgical scar, if you have any scar due to any accident or anything, either you can do some plastic surgery, and even plastic surgery also has some limitations. And we are using lasers to remove the scar, and the results are really amazing. See, this is like a surgical scar. We are laser for removing the scar, and this is purely a pigmented lesion, like a vascular abnormality also. And this is a clear example for tattoo removal. Tattoo removal, we are using, this is like a black ink. Normally many inks are used. If you see the film stars, if you see some Europeans or Americans, they are using multiple colors nowadays, like red, gray, ink, blue, many colors they are using. This is a very good example for the black color. Like after 20 sessions, the color can be removed like this. And after like a few sessions, we can almost remove the complete color with minimal skin damage. It's actually, tattooing is an invasive procedure. Actually, we are doing some invasive procedure, and it can be easily removed with the help of Q-switch lasers. This is one of the example. This is one of the example for vascular. It can be treated with the help of lasers. This is one of the example for warts, which is very common with some patients. It can be treated instead of doing some electrosurgical procedures. We are using the laser for the removal of warts. And this is another type of warts. It can be easily treated with instead of, actually normally doctors, what they will do, they will use the electrocautery or high frequency cautery for removing these type of things. But nowadays this has been replaced with the help of lasers. These are the very common procedures. Other things are like surgical procedures with the help of holmium and thulium lasers. I think you can easily check these things online also. And if you have any queries, let me know. I can, from my knowledge, I can answer for you people. And it's a very big field, frankly. I'm telling you, what will happen normally we all will concentrate in some field. Most of the biomedicals will concentrate in radiology field. They will concentrate in respiratory field or some other things. But this in laser field, so far I understand, in UAE I'm working here, and very few, especially from India, very few people are working in the laser field, because it's a very complicated field and highly paid also. Frankly telling you, the salary is almost same like those who are working in imaging field, because we have a mindset that only in imaging field we are going to get high salary. Not like that, but we are getting a very huge payment for those who are working in the laser field also. It's a very dedicated field and it's a very complicated field. So and in future we have a very big scope, because nowadays a lot of applications has been replaced with the help of lasers. So we have a big scope also. And I think we have like third year and final year students, right? And you people can think about getting more expertise in the laser field. Nowadays we started manufacturing the laser in our country. Before, it was most of the laser were imported from other countries. Nowadays a lot of companies started making lasers in India. So we have a very good future, and a lot of states are coming up with biomedical parks and everything. So the manufacturing sector have a very big scope. Don't think that your career is to work as a service engineer or a sales engineer or in teaching field. And research and development is a very big field, and you can do a lot in this field. If you have any queries, you can ask me. Madam, can you hear me?
Yes, sir. We hear you, sir.
Yeah, if you have any queries, students can ask me. I'm happy to.
Hello, sir.
Yes.
Sir,
Hi.
can you tell please how would you start your career in this laser? What the first
Actually,
point?
I started my career as a service engineer in the laser field. I was working as a hospital biomedical engineer. Then I joined in a small company with some laser products. There I was working as a sales and service engineer. And later on, I joined the competitor of the previous company. I'm working on. Nowadays I'm not into service. Before I was into service. So I have like not a very good idea, but I have an idea, good idea about how the laser really works. A good service engineer can become a good sales engineer, because technically very well. If you can easily convince the customer with your idea, don't think that a service engineer cannot become a sales engineer. A good service engineer can become a good sales engineer also. And don't think, when you start your career, don't consider your initial salary, because I started my career as a trainee. When I finished my engineering in 2009, it was like a recession. You people may not be remembering. It was a recession time. I searched everywhere, Bangalore, Chennai, all these places, and I searched for a job. That time nobody was, the salary they were offering like 3,500 and 3,000 Indian rupees. That I thought, okay, why should I spend my time in Bangalore and Chennai? Let me come back to Kerala and let me work somewhere. I started as a trainee. That time you won't believe, like I was paying to the hospital as a training fee. Later on, I got a good opportunity to work in a big hospital. From there, I got recruited to this one UAE based company. They came to Kerala and they recruited me from Kerala. Thank God, last almost like 10 years right now, I'm in UAE. Those who are especially for you students, don't consider your initial, nowadays, the youngsters don't want to work as free of cost. When you finish the course, you just need the salary from next month. You want a high profile job. Start your career slowly, slow and steady win the race. You can easily you have a very bright future. A lot of my juniors, my classmates are working in big companies. They all start. I know most of them work in very small companies in the beginning with a very low salary. Then slowly, when in 1-2 years or third year, fourth year, we slowly moving to next company. Don't stick on to a single company. This is one of my suggestion. If you are changing your job from one profile to another profile, you will be having an automatic growth. And like two different fields are there in biomedical. You can work as a service engineer, you can work in sales, you can work in application, you can work in research and development, or you can work in the teaching side and other research things also. The career, the growth will be different for each profile. The growth will be different. Service engineer, your growth will be like very, it will be like very slow. Once you start like a normal service engineer, it will take many years for you to become a service manager in a big company. But in sales, the growth, the salary, everything will be different. The more you're working, the more you can earn. This is a specialty of the sales. Sales is more or less, it's based on the targets. You have to achieve the target. You have to sell at any cost. You have to sell. If your product is good or bad, you have to sell. No other option. If you have any guidance, we can have later on. You can ask your madam. We can have an interactive session, and I can share my experience in this field.
Thank you, sir. I have one more question, sir.
Yeah.
Is there any exams from employee to then manager promotion?
Normally, no. There is no. Actually, in biomedical field, there is we don't have we have a certification. Actually, we call it as I forget the name, like AMI and two other international organizations are there. The mainly one certification is very common for those who are working in healthcare field, for those who are working in hospital field. I forget the name of that particular certification because many years back I tried to write this exam. This exam is actually a bit expensive and it's a bit tough also. If you have those certifications, it's very easy to find a job abroad. If you are looking for a migration or anything, it's very easy to get a job in hospital field if you clear those exams. This is the only certification. Once you finish BE biomedical engineering, that's your qualification. Either you can take some master's degree if you want to expertise in, if you want to go to some sales field or in admin level, you can take some MBA or anything you can take. Or if you want to continue in the hospital field, you can think about taking some certification like this. I forget the price of that particular exam. It's a bit expensive, and if you try for this exam, you can easily clear. It's not too much complicated. We have to start from very beginning. You have to start from very circuits, and everything will be there in the exam.
Thank you, sir. Thank you.
You can share. You can ask your concerns. When I was the first batch biomedical engineer student that time, that time nobody was there to guide me. Actually, we don't know where to go, whom to meet, and how to find a job. We are in like even I think Madam Shubha, I remember, like we people were like selected by IT companies. IT companies were recruiting biomedicals. That time we are thinking that once after finishing the biomedical, we can work in the IT field. But comparing with IT, biomedical is after considering your future, and till after certain time, IT companies will there'll be like, for example, once you finish certain level, you cannot go above that. But in biomedical field, you can do a lot. Once you start into sales things, you can start your own company. You can do your own. You can start your own production companies. Many of my friends I know, like I will tell you one example. One guy who did the diploma in Kerala is one of the role models for us in biomedical field. He was initially he was making some small equipments, like with some small technologies like LED and all those things. And now he is having his own manufacturing company, and he's doing a lot of things, like a lot of productions, like in neonatal and all those things he's making in Kerala. Like many people are there. If you go to Chennai also, a lot of companies are there. They are making equipments. They are making small equipments and big equipments. They are working with the international companies in the manufacturing also. That's it. No more questions. No more doubts. Normally, when I was a student, I used to ask a lot of doubts,
Yes, participants, do you have any queries?
Sir,
you can
Yes,
even
yes.
yeah.
Sir, if you treated to laser treatment, there is any side effect based
No,
of the
there is
human.
actually, this is a very good question. Very good. Your good name?
Akshay.
Yeah, this is a very good question. Nowadays, when I'm doing some demonstrations and some treatments, I used to tell the nursing staff or doctors to try the machine. That time they'll do, no, it's laser. It's something like it's not it's not an electromagnetic radiation. Electromagnetic radiation like X-rays, gamma rays, all these things. If you do some diagnostics or therapeutic, it have some after effects, right? Like we may getting some cancer or something like that. But laser is purely a light energy. The only complication is, as I told you, if you use the wrong parameter, if you use the wrong laser, and if you did not take proper precautions, it may have some side effects. Otherwise, lasers don't have a side effect. It has some certain side effects. For example, sometimes if you use some wrong lasers for a wrong procedure, it may simulate instead of for example, in hair removal field, normally if you are using a wrong parameter, it may simulate the hair growth also. Something like that, it may happen in the laser. Otherwise, there is no complications. We cannot tell. It is not like X-ray or gamma rays. Like many therapeutic equipments are there. It's not like that. It's purely very safe. And for any procedure, if someone is telling like you have to do the laser, go ahead. Don't worry. You can. There is no side effects for the laser actually. Side effects are there, as I told you. Side effects are there not from the laser, because of the wrong use of the laser. That's it.
Thank you, sir.
If you hesitate to ask question, you can send message also in the chat. You can write the question, because we have, I think. That's it.
Students, do anybody have any other questions? Okay.
Okay, sir. Thank you so much. Peter Drucker said, knowledge has power. It controls access to opportunity and advancement. But I think we get a lot of knowledge today because sir explained about laser, its treatment and its application in both medical and instrumental fields. S. Jayakrishnan sir has made so clear about what we can do in the field and how it will help us to in both financially and in the knowledge wise. And we'll surely take all your knowledge, sir, and convert it into power and help it for our opportunity and get advancement in our field. Thank you so much, sir, for coming to our webinar and giving a wonderful presentation. It was indeed a great opportunity for all of us. And now I invite Madhravani for giving the vote of thanks.
Before, I would like to share few time. You have time, right? I'd like to tell something about this field.
Yes, sir. Yes, sir.
Most of the students here, you people are from third year and final year, right?
Yes, sir. Yes, sir.
And I always tell, before you finish the course, you have to make sure that you have a very good idea about where you are going to work. If you are going to work in hospital field, a lot of things are there. We are just we are just studying some basics. We are just getting some basic idea about the equipments, and we don't have any clear idea how the equipments are going to work. Some topics are there. For example, electrical safety. Electrical safety, it's a very big topic. And Madam Shubha, I think we have to make sure that all those students who are coming out of the college should have a very clear idea about what are the electrical safety and what are the safety. For example, different classifications are there for the electrical equipment, for all the medical equipments. We are classifying into type 1, type 2, class 1, class 1B, class 1C. Many classifications are there. And if you want, I can share with Shubha ma'am some materials I have. I can share with you people. When I attended the interview for this UAE based company, they were asking questions mainly about the electrical safety. If you attend an interview here in a local company or in a local hospital, that most of the questions will be from the electrical safety side. Definitely one question will be there from electrical safety side. If you may be having
sorry to interview, sir. So 2017 regulation in Anna University, the students having that paper, electrical
really good.
safety
Really good.
yes.
Really
The
good.
previous syllabus and all there is not available, but now Anna University has introduced that one.
That's really good, because when actually I got like a mail from my college like asking our recommendation. I told about this thing,
Yes.
and if you want any materials, I can share with
Anyway,
you.
if you are having the documents there, please share it to us, because
No
we will
problem.
include that in our syllabus, because I am the member of the syllabus committee, so which will be helpful for all students.
Sure, ma'am. I will share with you, no problem. And few things like, for example, I have to concentrate more on nowadays a lot of companies are investing money in India only for the manufacturing. Once during the COVID time, we started thinking about surgical masks, like different consumables we are using in the healthcare field, and you won't believe, like millions and billions were involved in this business. Even in India, like now mask is very common, and we don't know like what type of material we are using, and we have to make sure. Madam, I have a suggestion, like at least by second year the students should start taking presentation about basic things in the biomedical field. No need to go for like big equipments. What I was doing in the second year and third year, we will be doing a lot of presentations about big machines like X-ray machine, LINAC, photon therapy, many things we are doing presentations. The students should start speaking about basic, like small things we are using in the hospital. Like what are these all are related to biomedical. Don't think that we are only concerned about the medical equipment. We are very much concerned about the biomaterials, the materials we are using in the hospital. And in third year and final year, you can think about speaking about big equipments. And one more thing you can do, ma'am, you can invite I don't know like what type of you can invite some of the local distributor of any companies. For example, if some student is inviting me to do a presentation, or they are inviting to do a hands-on session, I can go to that place and I can bring my device, I can show to the student. You can invite some of the company, like for example some local distributors. You can invite them, tell them to, for example, some ventilator supplying company, you can invite them to your college and let them come to the hospital with the equipment. Let them show to the student how the machine really works. For example, we are studying a lot of things about ventilator, but we don't know how the machine really works. Practical classes, we have to concentrate more on practicals. That was the main difficulty when I started my career. I have theoretical idea, but I don't know how really the machine works. I didn't see, because normally we are going for some hospital visit, right? Normally the students are going for hospital, that's it. So we'll be getting a very minimal idea. You can invite some of the companies to do the presentation, live in your hospital, in your college itself.
Yes, sir. We are now doing that workshop and all. So BioVision, one company is there. So we have an MOU with that. So third year, we give all training for this equipment training we are given, sir, but small module only. We are not giving any X-rays or MRI machines. We are giving only the small equipment hands-on training that we included in our syllabus. That is in value. We called it as value-added courses.
Okay, man, that's good. If you have any queries regarding how to
any other things,
or...
sir, for what about that medical coding and all, sir? Anything? It's medical coding. Any
medical
opportunity
coding,
is there in foreign?
Ma'am, medical coding is not related to biomedical field. Actually, my wife is a biomedical engineer and she did the medical coding. She was working in hospital field for a few years. Later on, she moved to medical coding. This is something related to insurance.
Yes.
For example, each procedure, for example, if you go to a hospital with your insurance card, because in countries like in India also, within a few years, insurance card will be very common. If you go to hospital with an insurance card, even for the consultation, there will be a code. For example, if you are going for a cardiology department and going for a consultation, there will be a specific code. Using this code, the hospital is going to claim money from the insurance company. If you do any procedure, a specific code will be there. You got it?
Yes, sir.
We are not going to tell like like I did this procedure. They will just enter the code and they will enter if you have any consumables, if you use anything, any other things. And once you send this request to the insurance company, they will ask you, for example, if you are going for with a fever and the doctor prescribe for ultrasound or MRI, automatically the insurance company will ask you why you have to do the ultrasound or MRI if you have fever, right? So everything will be, each things, because I know like it's a very big textbook they have. Each things will be like each procedure, each consultation, everything will be mentioned as a code. That is medical coding. And two things are, the medical coding is there and medical transcription is also there. This is not some related to our field, but we people can work in this field because we have a very good idea. We are studying anatomy, physiology, pathology, microbiology, all these papers we are studying. So we have a very good idea. So easily we can clear the medical coding, and medical coding have a good pay also. Frankly telling, medical coding, even in India
Yes,
also.
sir. Recent days, many medical coders are coming for our institute, and they take our students. So
But
that's
I
why
won't
I'm
recommend you. Frankly speaking, I won't recommend you. For example, I always tell my wife did this course. I should tell her, if you have worked in the biomedical field for this much years, you may be getting more salary than what she is getting right now. We have certain limit. After certain level, you not grow further. If you started with coding, you will be working as a medical coder, or you will go for like an insurance advisor or some quality control. That's it. Our real value, actually, the biomedical engineer, we have a value. We have a real value in the market. Actually, we are just dropping it. Medical coding is not something related to biomedical field, actually.
Okay, sir.
If any students, you can ask Madam Shubha, and she's actually in touch with me. And in future, because even one of your student, actually, one Mr. Fahad, he was in 2010 batch, I think so, in PSNA. He's my colleague in the same company. He's also working in the laser field. And this is yesterday when I was discussing with him, I told him tomorrow I have a presentation in your college.
Okay, we are happy to hear this word, sir. Our alumni is also working there.
Yes.
Okay, thank you for spending this much of time to us. Definitely our students has gained some knowledge about that medical laser. Okay. So who is wind up this session? Mohan sir, you can take out this session.
Thank you, ma'am, and thank you, sir. And now I call Madhravani to give vote of thanks.
Yes. Good afternoon, everyone. It's my immense pleasure to propose the vote of thanks for this wonderful webinar. On behalf of my college and the entire management, I'm very happy to extend our gratitude to the speaker for providing us with the valuable content on medical laser through his graceful words. At the outset, I would like to thank our management and our principal, Dr. D. Vasudevan, and our head of the department and the convener, Dr. B. Jayanti, for organizing this useful program. My special thanks to the Honorable and the respected Chief Guest, Mr. S. Jayakrishnan, Product Specialist, Dermatology Division, LaserTech LLC Abu Dhabi, for sharing his knowledge on medical laser in his busy schedule. It has been our tribute to host all the members and the participants of the meeting. It was really a very informative session, and we gathered a lot of useful ideas on the topic medical laser. Thank you, sir. Now, I would like to thank our coordinator, Mrs. B. Subha, Assistant Professor, Biomedical Department, for organizing this session and encouraging us to attend the webinar. Also, I would like to thank all the faculty members for being a great support throughout this session. Last but not the least, I'm very thankful to all the active participants for making this webinar a successful one by all your presence. I'm sure that our college will continue to arrange more useful and informative and interesting sessions like this in the future. Thank you.
Thank you so much, Madhravani. And now I kindly request all the participants to leave the meeting. Thank you so much.
Thank you all. If you have any queries, just please share with Mr. Shubha, and I can support you. And thank you for your time. Thank you for this opportunity. Thank you, Ms. Shubha. Thank you, Jayanti ma'am.
Thank you, sir.
Thank you, sir. Thank you.
Thank you so much, sir. Thank you, sir.
Hello, Mugan.